people there. So I'll give it a minute or two for anybody else to hop on. But welcome. My name is Pete Pigeon. I'm the Chief Operating Officer of Hobbs Advisors here in Columbia. Today we are we'll talk about Medicare, and we have a guest speaker with us. So this is our 5th webinar this year. And all of our webinars, just as a reminder, are on our website. We are going to record this webinar. We'll also have the slides for this webinar. So if any of you want anything from this, watch it again because it's going to be so great. Or for those that miss it, we'll have it available also on our website. And you can find our previous webinars on the website as well. So our guest, this is the first time we've brought in a guest, and that we brought an expert guest. We've got Chris Johnson, who is the Senior Vice President at Lourie Life and Health. Hopefully I don't butcher this. Lourie Life and Health is an insurance agency here in Columbia that focuses on Medicare and individual medical insurance. And they do a fantastic job. Good friend of mine, partners of ours. So he knows way more about Medicare than I do. So with that ado, Chris.
All right, Pete, Mark and team, thank you for having me. So today's focus is simplifying Medicare. So this is definitely our specialty is Medicare. So my goal here today is to help you from just a 50,000-foot view understand Medicare. We're going to start with original Medicare, talk about the 2 parts, A and B, and then really talk about what options you have from there. So we'll go ahead and get started. As Pete did say, I'm sure questions will arise. So you'll have the ability to ask those questions, and we'll take an opportunity to answer those as they do come up. So we are going to start with our table of contents. So a brief history of Medicare. As I mentioned, we'll talk about the 2 parts of original Medicare, A and B. We'll then talk about your options from there, Medicare supplement plans, prescription drug plans, Medicare Advantage plans. We'll talk about the enrollment period, so when you can enroll. We'll talk a little bit about the marketplace and Medicare, and then help for people with limited incomes, and then certainly any other questions that you may have. All right, to get started, a brief history of Medicare. So Medicare was founded on July 30th, 1965. So from President LBJ, signed into law the Social Security Act amendments let me say that again, it's easy for me to say, popularly known as the Medicare bill that established Medicare and Medicaid. The original Medicare program did include the 2 parts, A and B. So part A is hospital coverage, part B is your medical coverage. Today, these 2 parts are affectionately referred to as original Medicare. Who was the first recipient of Medicare? So the answer to that is, coincidentally, actually it wasn't here, but it's Harry S. Truman was the first recipient of Medicare. So signed into act by LBJ, and Truman was the first person to enroll in Medicare. So what is Medicare? Medicare is health insurance for people 65 and older, and certain people under the age of 65 with disabilities, those who have been disabled per their state for 24 months, or anyone diagnosed without delay with ALS, also known as Lou Gehrig's disease, or end-stage renal disease, kidney failure. All right, so here you've got a nice graphic of your Medicare options. I don't want to get in the way of this. So it really starts with original Medicare. So the 2 parts, A and B. We'll talk about those here in a second. But for someone looking at their individual Medicare options, so if you're retiring, if you're aging into Medicare, coming off an employer plan, et cetera, you really have 1 of 2 options to consider. So one option is a Medicare supplement plan along with a standalone prescription drug plan. The other option is a Medicare Advantage plan. And so we'll talk about the differences between these 2 options here. We tell our clients all the time, there is no wrong option. It's just what you think is best for you. And no 2 people will have the same needs. A lot of factors that go into the decision-making process, such as your budget, your specific prescription drugs, your doctors, your preferred hospital of choice. Do you plan to travel? Those types of things that go into the decision-making process about what may be best for you. Let's talk about original Medicare. So we mentioned the 2 parts, A and B. So for part A, Part A is again your hospital insurance, so inpatient services. Part B is your outpatient services, so things like doctor's office visits, et cetera. So for Part A covers, and when you think about original Medicare, it's medically necessary services. So for Part A, inpatient care in a hospital, so that's gonna, how do we go back? Okay. All right. So Part A, so your room, board, meals, prescription drugs that you get, while in the hospital, those are all covered under Part A. Part A also covers if you get out of the hospital and you're required to go to inpatient rehab after a 3-day hospital stay, it will cover inpatient skilled nursing, so skilled rehab. It also covers blood in an inpatient setting, home health care, and hospice. All right, and how do you pay for more Part A? Most people will not pay a premium for Part A. So if you work for at least 40 quarters or 10 years paying your Social Security taxes, your FICA taxes, you'll get Part A premium free. Now, for those people who did work less than 40 quarters, in a lot of cases that may be homemakers and they didn't pay into the system, there will be a premium for Part A. And one common theme you'll find with Medicare are late enrollment penalties. So again, most people get Part A premium free. If you did not work 40 quarters or 10 years, there is a premium due, and you do not enroll in Part A when first eligible. You do sign up down the road, there will be a late enrollment penalty. And again, that late enrollment penalty is a common theme for all of the different parts of Medicare that we'll get into here in a second. All right, so for the Part A cost, what you will pay for Part A services, if you were to go into the hospital and you had just plain red, white, and blue Medicare, so under Part A only, you would have a deductible of $1,556. That's per 60-day benefit period. The way the benefit period works is you go into the hospital, you get out of the hospital, and that's when your clock begins. So if you go back into the hospital within a 60-day time frame, whether it's for the same reason or a different reason, the original deductible applies. You're not going to have to pay another deductible. But if 61 days or more pass, you go back into the hospital again for the same reason or a different reason, a new deductible would apply. So I tell people, if you have just a catastrophic worst case year, you're bouncing in and out of the hospital, you could be subject to multiple deductibles per year at $1,556. Now, there is a copay. So if you're unfortunate enough to be in the hospital for a continuous stay past 60 days, there's an additional copay on top of your deductible. So for days 61 through 90, there is a copay of $389 per day. If you're in the hospital for a continuous stay past 90 days, there is a $778 copay for days 91 through, let me do my math here, my Lugoff math. So that would be 90 plus 60, 91 through 150. You get, those are called lifetime reserve days. You get 90 of those in your lifetime once they're used, and any days beyond that, you're on the hook for the full cost of your hospitalization. Now, skilled nursing after a 3-day hospital stay, if you have to go into an inpatient rehab setting, 0 copay for days 1 through 20. For days 21 through 100, there is a copay of $194.50. If you're still in skilled nursing past day 100, you're responsible for the full cost. Home health care, no cost for home health care services. There could be a 20% co-insurance for durable medical equipment. That's things like walkers, canes, wheelchair, oxygen, et cetera. Hospice, that's an end-of-life type setting. There is no cost for the hospice services. There could be up to a $5 copay for prescriptions to manage pain and symptoms, and 5% co-insurance for inpatient respite care. Blood typically comes from a blood bank like Red Cross, and there generally is no cost for that. All right, so benefit periods in Medicare, and I actually just touched on this. So I mentioned that inpatient hospital copay that you've got for days 1 through 60. And so that if you went back into the hospital after 60 days were passed, you could be subject to another deductible, and there are no limit to the number of benefit periods you could have in a year. And it all starts over, it's all based on a calendar year. So, January through December. So every year it resets January 1st of the following year. So for Part B, let's talk a little bit about that. Again, Part B covers outpatient services. So doctor's office services, outpatient surgery, labs, durable medical equipment, diabetic testing, preventive services, home health care, et cetera, outpatient physical therapy, those types of things are all covered under Part B. And so what are your costs under Part B? Your premiums. So keep in mind, most people get Part A at no cost, premium free. So there is a premium for Part B. So for all intents and purposes, this is the premium for Medicare. Most people, the standard premium for this year is $170.10. Now, some people may have to pay a higher premium. So for high income earners, and so Medicare loves the alphabet soup, it's called IRMA. It's an income related monthly adjustment amount. So higher income earners could pay more. And if y'all have questions on that, get with Pete and the team at Hobbs Groups, because they can help you understand what you may end up having to pay, and could potentially talk about, some exercises to potentially decrease your income related monthly adjustment. Now, there are some people, the people with the lowest incomes and assets may pay less than the standard premium of $170.10. At the end of the day, the amount that you owe will be communicated to you by Social Security. Yes, we've got a question in the back.
Is that premium monthly?
So that is a monthly premium, correct? Yes. Thank you. I think we're going to talk a little bit.
It's communicated in January of each year. Is that?
Well, actually, it should. So the cost for next year should be coming out soon. And so, in fact, good point. Thank you for the question was, when is the premium for a given year communicated? The cost that we're going over here today, the premiums and cost sharing and Medicare are for this year, for 2022. It has not been communicated yet what the cost will be for next year, for 2023. It is rumored that the Part B premium will actually be going down. It's the first time in my 16-year career that will happen. Without going too much into the weeds, there were a lot of factors, COVID, et cetera, that we saw one of the highest increases in the Part B premium this year than we have historically. Next year, it actually could be going down, which would be good news for a lot of people. That generally is communicated, really in the next few weeks or so, we'll see those numbers come out. So now here are the limits for the income related monthly adjustment for high income earners. It's based on how you file your taxes. So for individuals making $91,000 or more, they'll pay anywhere from $238.10 per month, up to as much as $578.30 per month. And then for those that are married filing jointly, it's incomes of $182,000 or more. And again, this is per person. So if it's merely I have to stop touching the screen here. Sorry. Go back here. All right. So, but it would be the $238.10 up to $578.30 per person per month that they could be. And if you fall into this category, do talk to Pete and the team here so that they can help you understand what you may end up having to pay, and hopefully maybe even try and minimize that as much as possible. All right. Next slide. All right, so that is your premium. And again, that is for all intents and purposes, most people get Part A premium free. That's the Part B premium. That is your premium for Medicare.
Chris, can I interject for 1 second?
Yes, sir.
I'll say one thing about that
Please,
previous
come
slide.
on up.
Sorry. Okay, I'm hopping up here for 1 second because I wanted to point out, as Chris said, when you see on here, and this is kind of interesting, this, if you apply for Medicare in 2022, Chris, correct me if I'm right here, or verify it, the IRS is using the income from your 2020 tax return. So they're 2 years behind on figuring out these numbers, these extra premiums you pay, right?
Correct.
So the idea of this, let's say you retired last year in 2021 and your income is substantially lower in 2022, but yet the IRS has your income, or Social Security has your income from 2020, and that's where they're basing this on.
Yep. And there's an appeal form that,
Right.
that we can help, y'all can help with. to appeal based on your lower income, based on the fact that you're no longer working.
Right, and that's where I wanted to point out that what we've had some success helping some of our clients is file that appeal when your income is substantially lower. The other example would be if you had a huge income from selling a piece of property or, you know, a huge any sort of taxable income event that there was a spike in a one-time deal. You can also file appeal to Medicare to point out that your income going forward is not going to be that much, so that you can reduce this IRMA basically penalty is what we like to call it. So sorry, that was
The luxury penalty.
One interjection
to it. So the luxury tax. Thank you. All right, moving on. So your Part B cost sharing. So what you'll pay for your outpatient services, doctor's office visits, et cetera. You're going to pay a yearly deductible of $233. So the definition of a deductible, you have to pay 100% of that first. So for your first doctor's office visit, outpatient surgery, et cetera, you'll pay the first $233. At that point, you're on the hook for 20%. So Medicare is going to pick up a majority of the cost. They're going to pick up 80%. You're on the hook for 20%, but that's 20% of every service, every procedure that's done. So every doctor's office visit, every lab, every outpatient procedure, et cetera, you would be on the hook for. And again, that's if you were just enrolled in plain red, white, and blue Medicare. We'll get to that, but there is really no logical reason anyone would want to stay enrolled in plain red, white, and blue Medicare. For those that are retiring, coming off of their employer plan, aging into Medicare, they would want to consider one of the two options that we'll get to here in a second. So somewhat to that point, Part B and active employment. So if you do have coverage through an employer, either through your employment or your spouse's employment, you may want to consider delaying in Part B. And this is really if you work for a large employer with 20 or more employees. If you do have any questions, of course, you can speak with a licensed insurance agent. The best question, though, is to ask your benefits administrator. And the question is to consider whether or not your employer is considered a large employer, not 20 or more. Now, if you do work for a large employer, 20 or more, you delay enrollment in Part B because you have coverage through your employer that's as good as Medicare. There is no penalty to enroll in Medicare. You actually can enroll in Medicare at any point, even if you're still working. So if you stay enrolled in your employer plan post 65 and you decide at any point down the road that you want to enroll in Medicare, you can actually do that at any point. And then once you do lose that employer coverage, which in most cases is when you retire, but there are some certain situations where employers may just drop coverage. You do have a window within 8 months of losing coverage to enroll in Medicare via a special enrollment period. And during that 8-month window, you can enroll in Part A and Part B without delay and with no late enrollment penalties. All right, so now if you do not have coverage from an employer plan, delaying Part B may mean higher premiums, so a late enrollment penalty. It may mean that you have to pay 100% out of pocket for your health care. And then you can't just sign up for Medicare whenever you want to. You have to wait until the general enrollment period. So the general enrollment period we'll get to here in a second. We'll give you the time frames for that. So the general enrollment period, though, is a 3-month window. It's actually January, February, and March of each year. And then Medicare won't start until July 1st of that year. And at that point, you're going to have to pay a late enrollment penalty. And that whole time period of which you're having to wait for Medicare to start, you're without coverage. If you need care, you're paying 100% of the cost for that care. You do not want to end up in that boat. All right. So when you must have Part A. So you have to be enrolled, when you must have Part B. To enroll in a Medicare supplement plan or a Medicare Advantage plan, you must be enrolled in Part B. If you're eligible for TRICARE for life or for the CHANT VA, that's for civilian, then you must be enrolled in Part B. If your employer coverage requires that you have it, which would be for the small employers under 20, you must enroll in Part B. And again, any questions about large or small, simply talk to your HR or your benefits administrator. All right, when is enrollment automatic for Part A and Part B? So if you are drawing or receiving Social Security or Railroad Retirement Board benefits on your 65th birthday, you will be automatically enrolled in Medicare. So enrollment in Medicare, just to reverse that, it is only automatic if you're receiving Social Security or Railroad Retirement Board benefits. So when I started 16 years ago, 100% of the people I met with were receiving Social Security on their 65th birthday. Now, as the full retirement age goes up, and what is the full retirement age now, Pete?
66 and 6 months or something.
Around there. And so more and more people are choosing to delay their Social Security retirement benefits because you want to get a bigger check, and that's great, that's fine. But know that when you turn 65, you will not be automatically enrolled in Medicare. I'm going to get to that here in a second. So for those people who are receiving Social Security retirement benefits approaching their 65th birthday, 3 months before their 65th birth month, they're in their initial enrollment period. And so 3 months before their 65th birth month or the 25th month of receiving Social Security disability benefits, you'll be mailed your initial enrollment period package, which will contain your Medicare card with both parts A and B. All right, so you'll have both parts A and B automatically. If you are in an employer that's 20 or more employees and you want to delay Part B, then you would simply send your card back, and there's instructions in your initial enrollment package about how to send it back. You would send your card back to Social Security. Hey, I don't want Part B. They'll send you a new card back with Part A only. And there's no reason you wouldn't want Part A. There's one exception to that, because most people, again, get Part A if you're premium free. The only exception to that is if you're enrolled through your employer in an HSA plan or a high deductible plan with an HSA, and you're contributing to that HSA. Once you are enrolled in any part of Medicare, you're no longer eligible to contribute to that HSA. So again, any questions on that, make sure you're speaking with your benefits administrator, your HR person, a licensed insurance agent, etc. All right, and I mentioned the instructions or everything else there we really review. All right, when must you take action to enroll in Medicare? And so for those people, again, that are delaying their Social Security retirement benefits, you will not automatically be enrolled in Medicare. So once you become eligible for Medicare and you need to enroll, you do not have that offer of employer coverage, or you've done the math and you've determined that, yeah, it's actually a better bet for me to go enroll in Medicare and sign up for a Medicare Advantage or a prescription drug plan versus staying enrolled in my employer coverage. If you fall into either of those scenarios, you will need to enroll in Medicare. It's really easy to do it. Easiest way to do it is just to create an account on the Social Security website. You can just Google apply for Medicare. You'll have to create an account, go through some identity proofing, and then from there, it takes less than 5 minutes to apply for Medicare. You can also do it in person at the Social Security office. I would not recommend that, they're backed up, or you can call Medicare as well. All right, does original Medicare have a cap? So this is where I summarize now. So under Part A, remember that if you had that catastrophic worst case year bouncing in and out of the hospital, you could be subject to multiple benefit periods, which means multiple deductibles and copays under Part A for hospitalization. Once you've met your Part B deductible, that annual deductible of $233, Medicare is going to pick up a majority of the cost, 80%, but you're on the hook for 20%. But that's 20% of every service, every procedure that's done. And with original Medicare, this is the important part, there is no cap or maximum out of pocket. So if you had just plain red, white, and blue Medicare, you had that catastrophic worst case year, you could be subject to an unlimited 20% and potentially deductibles under Part A. So again, that said, no logical reason anyone would want to stay enrolled in plain red, white, and blue original Medicare. So you'll want to consider one of two options. Now, we'll get to those here in a second. A Medicare supplement along with a standalone prescription drug plan or a Medicare Advantage plan. It's also important when we talk about original Medicare, What is not covered? So I mentioned earlier that Medicare covers medically necessary services. They don't cover most dental care. So most dental care is not currently covered. Any eye exams, so routine eye exams or exams related to prescribing glasses, that's not covered. When it comes to vision care, if it's medically necessary, that's covered. So glaucoma, cataracts, macular degeneration, you injure your eye, that is covered under Medicare, but you just need to get new glasses, a new prescription, you need a routine eye exam, that's not covered under Medicare. Dentures are not covered, cosmetic surgery, routine physicals, you actually get one physical, it's called a welcome to Medicare physical, but then that's the only physical that's covered, so one per lifetime. Massage therapy, massage therapy is not covered.
Sean Watson would like that.
Okay, so acupuncture, hearing aids and exams, long-term care, et cetera, are not covered by Medicare. Also, Medicare doesn't cover prescription drugs at your pharmacy or through the mail. So you would want to consider other coverage for that. We'll talk about that. So in original Medicare review, it includes Part A and Part B. So your inpatient and inpatient hospital coverage, Part B, outpatient medical coverage. Once you've met your Part A and or Part B deductibles, you are subject to copays and or a 20% coinsurance, no cap or maximum out of pocket. In most cases, there is no reason you would want to stay with original red, white, and blue Medicare. To help you cover your cost, you will want to consider one of the two options that we've gone over. So let's go into more details on those. So we're going to start with Medicare supplement plans. So Medicare supplement plans and Medigap plans are one and the same, hence the name. They supplement or fill in the gaps in Medicare. So depending on the plan you choose, they will pick up those Medicare deductibles, copays, coinsurance, et cetera. Again, Medicare loves their alphabet soup. Medicare supplement plans are identified by letters A through N. Those plans are standardized, which means that any plan identified by a given letter has the same benefits. So I'm going to mention Plan G. For those of you that are aging into Medicare as of this year or beyond, Plan G of the Medicare supplement plans that are offered is the most comprehensive of all Medicare supplement plans. That Plan G will have the same exact benefits no matter which company you go with, whether it's Blue Cross Blue Shield of South Carolina, United Healthcare, Aetna, or Acme Insurance Company. That Plan G will be a Plan G no matter who you sign up for coverage with. The only thing that will vary is the cost, the premium. And I tell my clients and prospects all the time, don't get caught in the trap of just finding the lowest premium plan, because generally speaking, those companies that have the lowest premiums are not able to maintain that coverage. All Medicare supplement plans will go up the older you get. So what you want to look at is companies that offer price stability. May not be the least expensive today, but will be historically over your lifetime. All right, so here are the different plans, A through N. I'm not going to go through all the plans here today, but I mentioned Plan G. So Plan G is the most comprehensive. So for those of you who are becoming eligible for Medicare this year or beyond, Medicare Plan G, your only cost that you'll be subject to is your Medicare Part B deductible. So the first $233 of your outpatient services, typically it'd be your first couple of doctor's visits, you satisfied that. From there, that Plan G will pick up all of the rest of your Medicare costs, all of your deductibles, copays, coinsurance. You simply pay your Plan G premium, your first $233 for outpatient services, and then it will pick up 100% of the cost for the rest of the year. There are other options. So it looks like this is going to.
We're good.
Okay. All right, so what is not covered by Part A and Part B? So we really touched on this. Drum roll, please. I love the drum roll. About that.
What's
So just to review some of the items and services not covered. Can we just get a drum roll on every slide? So I want it on every slide. So We mentioned these, but routine services are not covered by original Medicare. All right, when is the best time to purchase a Medicare supplement, also known as a Medigap plan? It's during your open enrollment period. Again, this is where Medicare can get very confusing because we'll talk about Medicare Advantage enrollment periods. That is a separate enrollment period for people who are enrolled in Medicare Advantage. There's also the Medicare annual enrollment period, October 15th to December 7th. We'll talk about, which is a lot of times referred to as open enrollment. But there is a Medicare supplement open enrollment period that begins. It's a 6-month window that begins on your 65th birthday and when you're enrolled in Part B. Once it starts, it cannot be stopped. But during that 6-month window, you can purchase any Medicare supplement plan from any company, regardless of health. So not having to show, not having to fill out any type of underwriting, filling out any type of applications, no questions asked during that 6-month window. You can choose any Medicare supplement plan. All right, so here are just some sample premiums for you. So I am going to use Plan G as the example. It is also the most popular plan by far because of it being the most comprehensive of the Medicare supplement plans. So for a Medicare supplement Plan G, premiums can vary based on where you live. They can vary. Typically, males are going to pay more than females, but just some sample blended premiums here based on South Carolina. For a female turning 65, $99 per month. For a male, $112 per month. So keep in mind with a Plan G, I mentioned this a second ago, you would pay the first $233 of your doctor's office visits and outpatient services. After that, you simply pay your $99 or $112 premium plus or minus. Medicare is going to pick up 100% of the costs from there. Now, I'm just going back up real quick here. Got to put in my little disclaimer here that the examples are given for general in nature. We got this little box down here, but just know there are no guarantees to be implied here on these sample premiums. So. All right, let's talk about prescription drug plans. So I mentioned that original Medicare doesn't cover prescription drugs, through the mail or the retail pharmacy. And so you would want to purchase a separate standalone prescription drug plan if you have purchased a Medicare supplement plan. There are 2 ways you can get prescription drug coverage. And so one way is a standalone plan paired with a Medicare supplement plan. The other way is part of a Medicare Advantage plan. These are technically optional plans, but also these plans, remember the late enrollment penalty. If you do not sign up when you're first eligible for Medicare, you do then sign up down the road, you will be subject to a late enrollment penalty. Costs vary by plan. There is a wide variation in plans. The average person over the age of 65 takes 5 to 7 medications. And so every plan has its own formulary, which is the list of drugs they cover. They all have different tiers. So one drug may be a tier 3 with one company. It could be a tier 1 with another company. And so you want to make sure that you're researching your options based on your specific prescription drug. And there's tools that we can help you with to do that so that you can find the plan based on your specific prescription drugs that's going to save you the most money. Also, they all have different networks as well as far as which pharmacies are in and out of network. Now, remember IRMA from earlier, the luxury tax. So the income related monthly adjustment for Part B also applies to Part D. So for the prescription drug plan, it's the same thresholds. All right. And so you could pay $12.40 up to $77.90 more per month for your prescription drug plan. So whatever category you're in for IRMA for Part B, you'll be in the same exact category for Part D for drug plans. All right, how Medicare Part D works. So I mentioned technically it's optional. Each plan has its own formularies, the list of drugs they cover, and you must live in the plan's service area in order to qualify. Generally, those are based on the state. So if you do not sign up for coverage when first eligible, and then you do sign up down the road, I mentioned the late enrollment penalty. So you would have to pay a penalty. It's listed down here. It's a penalty. It's 1% of the national base premium, so 1% of $32.74 for every month that you were eligible for coverage but not enrolled. You would have to pay that for the rest of your life. The only exceptions are if you did have credible coverage is coverage as good as Medicare Part D, so such as through your employer plan, or if you qualify for extra help or Medicaid, then the late enrollment penalty would not apply. And if extra help and Medicaid, again, are for those people with the lowest incomes and assets. So some sample premiums. So we mentioned the sample premiums for the Medicare supplement plans. Average premiums for prescription drug plans are going to be anywhere from $15 to $35 per month. So you're going to pay your Medicare Part B premium. You're going to pay your Medicare supplement premium, and then you're going to pay your prescription drug premium. So those would be your monthly premiums there. All right. Let's talk about Medicare Advantage plans. These are increasingly popular plans. So Medicare Advantage and Part C are one and the same. These are the all-in-one plans that you see a lot of times advertised on TV. So these plans combine all your Medicare covered services. Most plans include prescription drug coverage as well. These plans will offer maximum out-of-pocket protection. So if you have that catastrophic worst case year, you are protected. But these plans also include the extra benefits like dental, vision, hearing, health and wellness programs, etc. So Medicare Advantage plans are offered by private insurance companies. A lot of the same plans that offer the Medicare supplement plans also offer the Medicare Advantage plans. It's important to know that if you do enroll in a Medicare Advantage plan, you are protected by Medicare. You have all of the same coverage that you would have under original Medicare. Your Part A and Part B services that insurance company is required to cover. But these are network-based plans. And I'm gonna back up real quick. Medicare supplement plans, there are no networks. So Medicare is always primary with a Medicare supplement plan. And so you can go to any provider in the United States, no questions asked. With a Medicare Advantage plan, though, these are network-based plans. So you may be limited on where you can access care. I will say these plans, most plans, though, do have very robust networks. Many of them do have nationwide networks as well. In addition, in a Medicare Advantage plan, you still have all of your Medicare rights and protection. You still have all the services under Part A and Part B. You can choose a plan that includes prescription drug coverage, and many plans do include those extra benefits that I mentioned, like the dental, vision, gym memberships, etc. Now, how do these plans work? You must live in the service area. Generally, these plans will vary from county to county. So if someone on today's webinar in Richland County may be offered different options than, say, someone who's in Kershaw County. When you sign up for a Medicare Advantage plan, that Medicare Advantage plan becomes primary for you. Medicare is going to pay the insurance company to manage your care. Now, you generally have copays. These plans work a lot like employer-based plans where you pay a copay to go to the doctor. A higher copay for a specialist. You'll have set copays for hospitalization. You do have that maximum out-of-pocket protection, etc. Copays for primary care, just to give you an example, can range anywhere from, say, $0 to $15. And then you are capped for, if you have that catastrophic worst case year, for your medical services only, up to $7,550. Some plans have much lower maximum out-of-pockets than that. So, sample premiums for a Medicare Advantage plan. Remember that this plan becomes primary for you, includes the extra benefits, and most plans include the prescription drug coverage. Premiums range anywhere from $0 per month up to $45 per month. Most people are enrolled in a zero premium plan. And again, this is for illustrative purposes only, no guarantees of coverage to be implied. So when can you enroll in Medicare? So you have your initial enrollment period. So this again is based on your 65th birth month or your 25th month of receiving disability benefits. It actually begins 3 months before the month of and 3 months after. So during this window, you can sign up for Part A and Part B. You can sign up for Part D, and you can also sign up for a Medicare Advantage plan. And there are no late enrollment penalties during your initial enrollment period. Now, if you are enrolled in a Medicare Advantage plan, and again, this is where this is different from the Medicare Supplement open enrollment period. That's a 6-month window when you turn 65 and are enrolled in Medicare. Just keep in mind, this is called the Medicare Advantage open enrollment period. So the only people who can exercise this enrollment period are those who are enrolled in a Medicare Advantage plan. It is an additional window. It's January, February, and March, during which you can actually change to another Medicare Advantage plan, or you can go back to original Medicare and enroll in a standalone prescription drug plan. Now, there are some special enrollment periods. So if you move, in most cases, that's a special enrollment period. If you leave or lose your employer coverage, if you do qualify for Medicaid or extra help, there are also a special subset of Medicare Advantage plans called chronic special needs plans. So if you qualify for such as diabetes or congestive heart failure, you may be able to enroll in one of those special needs plans any time of the year. And then the annual enrollment period. So this is coming up. So the annual enrollment period. So for those of you that are enrolled in a Medicare Advantage plan and or prescription drug plan, each year, starting October 15th and ending December 7th, you're allowed to make as many changes as you would like to that coverage. The last plan chosen on December 7th is the plan that will take effect January 1st of the next year. So this is the time of the year that you'll want to review your coverage. So are you in the right Medicare Advantage plan? Are you in the right prescription drug plan? Are they covering all of your medications? Is there maybe a new plan or another plan out there which may better serve your needs? That's when you'll want to review your options. All right, let's talk about the marketplace. So for those of you who may be approaching Medicare eligibility, if you're enrolled in the marketplace through the Affordable Care Act, it is important to know, and I'm just going to go ahead and summarize, you cannot keep that marketplace coverage once you become Medicare eligible. You'll want to disenroll from that marketplace plan once you're Medicare eligible. And so theoretically, there is no coordination of benefits and there's no communication. So, the marketplace won't know, even though you're turning 65, that you're Medicare eligible. So you'll need to actually physically disenroll or drop your marketplace plan, then enroll in Medicare once you are eligible. Yeah, I must be doing such a great job that there are no questions coming, right? There is help for people with limited incomes and resources. So for those people who have the lowest incomes and assets, you may qualify for additional assistance to cover your prescription drug costs. And for those with the lowest incomes and assets, it will could even potentially pick up your Medicare cost share, the Part A and Part B deductibles, co-pays, etc. All right. So what is Medicaid? It's a joint federal state program for those people with the lowest incomes and assets. This is the program that would pick up not only your Part B premium, but it would pick up the 20% and the deductibles, et cetera, in Medicare. All right, and then just here are the eligibility requirements for Medicaid. So again, it's for those with the lowest incomes, and there's asset requirements in addition to this. So for full Medicaid, it's individuals under $1,094, married. For those that are married, $1,472 per month for full Medicaid. If you have questions about your eligibility for Medicaid or extra help, go to the Medicaid office. You can also go to the Social Security office, or you can also go online through socialsecurity.gov. Some helpful websites: Medicare.gov, Medicaid.gov, socialsecurity.gov, healthcare.gov is for the health insurance marketplace for those under 65. Insure Kids Now for the CHIPS program. And then shiptacenter.org for the state health insurance program. Key points to remember, Medicare is health insurance for those 65 and older and under 65 with certain disabilities. It doesn't cover all of your healthcare costs, so there are deductibles, co-pays, et cetera, that could apply. You have choices in how you get your coverage and what coverage you choose. There are programs for people with limited income and resources. Decisions affect the type of coverage you get. Certain decisions are time sensitive. In most cases, there's no reason you would want to stay enrolled in plain red, white, and blue original Medicare, the A and B. To help pay your out-of-pocket costs in original Medicare, you will want to consider one of two options: a Medicare supplement plan, along with a standalone prescription drug plan, or a Medicare Advantage plan. Mark.
Chris, y'all are specialists in this area. Do you have more people with supplement plans or with Medicare Advantage plans?
So if you look at the people who are coming into our office who are eligible for Medicare for the first time, you know, the number of people enrolling in a supplement plan is higher. I mean, if you looked at our total, all of our clients, you know, you're going to see a higher number of Medicare Advantage. And a lot of reason is during the annual enrollment period, the people who are already enrolled in a Medicare Advantage plan that aren't our client, that are calling in and we're helping with. I think the better way to gauge that is if you're the people who come into our office that are retiring or turning 65. If I had to peg a number, it's probably 40% Medicare supplement and roughly 60% that are enrolled in a Medicare Advantage plan.
And why is that?
So, you know, there are a lot of factors that go into it.
Yeah.
So Medicare Advantage plans have become more popular over the years. We've seen premiums and co-pays, et cetera, go down. We've seen the extra benefits that they offer.
Gym membership and
the
all the things
dental,
you
the
mentioned,
vision.
some of the stuff that's not covered by the supplement.
They become more rich, you know, and again, I'll give you an example. You know, I have a husband and wife client. He's a retired doctor, was on the board at MUSC. His wife was a homemaker. And so, you know, lots of income and assets. When they first became Medicare eligible, gave them the presentation, you know, talked to them about the difference between an Advantage and a supplement plan. And the wife, who, you know, controlled finances, said, Chris, you know what, we can afford the Medicare supplement. It's not a question about whether we could afford it, but you know what, we're healthy. We don't expect to you know, need services. We go to a gym, so we like the, you know, save money right there on our gym membership. We like these extra benefits. And so they enrolled in a Medicare, and she said, if something happens to us, we can afford to cover, you know, those co-pays, and even if we hit the maximum out of pocket. So they chose to enroll in a Medicare Advantage plan. 5 years later, sat back down, you know, we reviewed everything again. And at that point, they actually decided to enroll in a Medicare supplement plan. But, you know, there's another example. I kind of give both sides of that. Had a client in rural South Carolina I went and met with, and she was aging into Medicare the next month. Her only source of income was Social Security. She was just over the threshold for Medicaid. She had literally, like 2 weeks before I met with her, been diagnosed with breast cancer, and had already chosen to go through full chemo and radiation, you know, which is extremely expensive. In most cases, she, you know, people in her situation would not have the income to be able to afford a Medicare supplement plan. But in her situation, looking at the cost that she was about to deal with, she couldn't afford not to go into a Medicare supplement plan. And I found out 3 months later that she had passed away. And it gave me comfort knowing that, you know, she was able to fight her fight. And the one thing she didn't have to worry about was a doctor or hospital bill. So it's an individual conversation.
Thank you.
Based on one's individual needs.
Chris, can I ask you a follow-up question to that? So the ability to go back into original Medicare after you've chosen a Medicare Advantage plan, is that a one-time deal?
So the question was, if you chose a Medicare Advantage plan, what are your options to go to a Medicare supplement plan down the road?
Correct.
And it's a good question. That's also part of the consideration. So if you recall, for a Medicare supplement plan, you have a 6-month window, which you can purchase any Medicare supplement plan at any time. Not to get, you also get a 1-year trial, right? So you essentially get a 1-year window. And again, this is where it's getting really technical. That 1-year window only applies for people who sign up for Medicare Part A at 65 and enroll in an Advantage plan. But whether it's 6 months or a year, you do have a window if you do enroll in an Advantage plan, of which if for whatever reason you're not happy, you can then go back to original Medicare, enroll in a standalone drug plan, and select a Medicare supplement plan. After that window passes, you enroll in that Medicare, and then we'll go back to my 2 clients. He was a doctor, and his wife, lots of income and assets. They chose the Advantage plan. If, say, 2 years down the road, one of them was diagnosed with cancer and wanted to go to MD Anderson, who's generally not in network with any Medicare Advantage plan, but they accept Medicare and a Medicare supplement plan, that would not have been an option for them at that point. They would, because at that point you have to go through underwriting. You have to answer health questions. So fortunately, when I did meet back with them 5 years later, they were still very healthy. So they were able to easily pass through underwriting. So I tell people to that point, Pete, if you're leaning towards a Medicare supplement plan, the best time to sign up for that is now, when you're becoming eligible for Medicare. It's always easier to sign up for a Medicare supplement plan and then switch to an Advantage plan down the road than it is to start with an Advantage plan and then switch to a Medicare supplement plan.
That's very helpful.
Yeah.
Thank you.
Yeah, sure. All right, I think we are really on the tail end here. So I did such an amazing job that I really answered all the questions that you all had.
So I wanted to maybe just summarize a couple of things that I thought about, which, I learned a great deal in this presentation. Do we have any questions from the Zoom audience? No? Okay. Well, I wanted to point out a couple of things, and I think that when you're turning 65, you're going to get what, maybe like 5,000 different solicitations.
You're the most marketed to demographic in all the United States.
So these providers will know it. So you're going to get all these different marketing mail dumps, right? About this plan, that plan. Our recommendation to our clients is talk to someone who specializes in this, not someone that dabbles in Medicare, because as you can see, it's alphabet soup. There's deadlines, lots of ways to screw this up. And so what we like about Chris and Joel at Lourie Life and Health is that, one, they're extremely competent. They're educators. They explain all this to people one-on-one. They're not just pushing a particular product, and they've got a team of people that do this all the time. So they're experts. So that's why we recommend our clients to go there. And I just think if you're going to go through this process, you need to talk to somebody who specializes in this, because there's just lots of problems that can occur, not even originally, maybe down the road if you get steered in the wrong direction. I also want to point out that a lot of times we're talking to our clients as financial planners about early retirement. And as Chris mentioned, the marketplace, which some people call Obamacare through the Affordable Care Act, is also a mechanism for early retirees who retire prior to 65 to gain coverage. I used to hear the term that we're working because we need insurance, which, because of the Affordable Care Act, that's not an issue anymore. So therefore, if you're thinking of retiring prior to 65, that's also an opportunity to talk to someone who specializes in that, that could help you in that area too. So Chris, we thank you very much for your time. We thank you all for being here. And like I said, this will be recorded.